In this episode of the Health Momentum, we ask, what happens when your doctor cannot physically reach you? And who pays the bill when healthcare leaves Earth? Let's dive in. Picture yourself floating hundreds of miles above the planet, looking down at Earth through a tiny window, when suddenly your body betrays you. A cut, a flare-up, or a sudden illness. There is no doctor beside you, only a voice crackling through delayed signals, guiding your every move. Now ask yourself, who is footing the bill for that care? Who decides if treatment is approved? And what happens if something goes catastrophically wrong? Healthcare billing was built for hospitals on Earth. Every procedure, every documentation rule, every reimbursement system assumes a patient under gravity, inside a licensed facility, within a jurisdiction that makes sense. Space flips all of that on its head. A simple wound closure in orbit is different. Administering fluids takes new skills. Even diagnostic tests must be adapted. How do you code that? How do you bill for it? And who pays? Here's where the numbers get interesting. Commercial spaceflight launches have increased by more than 30% year over year, and over 60% of private missions operate outside traditional insurance coverage. Telemedicine in extreme environments has grown over 40% in the last year. An emergency medical evacuation from an International Space Station can cost between $50 and $100 million. These are not minor details, they are signals about the future of medicine. There are pros and cons to this brave new world. On the plus side, space medicine drives innovation, pushes telemedicine forward, and encourages contract-based models with clear agreements and bundled care. On the downside, the costs are astronomical, legal frameworks are murky, and documentation is complex and time-consuming. Understanding these trade-offs is critical for anyone thinking about the future of healthcare delivery. There are also myths that need busting. Some people think NASA covers all space medical costs. That is not true. Many commercial missions fall outside NASA oversight. Others believe telemedicine laws do not apply in space. Wrong again, jurisdiction and liability still follow providers and patients. And finally, some assume that space medicine is experimental and unbillable. In reality, the care is real, the risks are real, and so are the bills. So, what can healthcare professionals do today to prepare? First, document everything meticulously. Environmental constraints, communication delays, equipment limitations, and clinical reasoning must all be recorded. Second, move away from traditional fee-for-service billing. Use contracts, bundled care agreements, and risk-sharing models. Third, align liability with payment. Never provide care without legal protection. Fourth, plan for telemedicine complexity and clarify which laws and privacy rules apply. And finally, review the ethical implications. Risk, cost, and patient consent must be explicit, not assumed. Consider the recent first-ever medical evacuation from the International Space Station. There was no on-board physician, decisions were made remotely, and costs skyrocketed into the tens of millions. Medically, it succeeded. Administratively, it was a nightmare. Billing had to be improvised, liability was unclear, and ethics hung in the balance. This single event teaches us more about the future of medicine than any textbook ever could. Experts agree, space is forcing us to rethink everything. Billing systems must evolve. Documentation must be meticulous. Liability must be crystal clear. Ethics cannot be assumed, they must be explicit. And the lessons learned in orbit will trickle down to healthcare on Earth. Now, here's a question for you. Would you trust a procedure guided from hundreds of miles away with communication delays and high risk? Drop a comment below and share your thoughts. Talk to a colleague who thinks beyond the hospital walls and share this episode. Let's start the conversation about what healthcare will look like in the next frontier.